The Virtual Curbside is a production of the Utah chapter of the American Academy of Pediatrics, the Utah AAP, working together to improve children's lives through education, advocacy, and networking. Hi, this is Paul Wirkus from the Utah AAP. Welcome to this week's edition of the Virtual Curbside, where we bring pediatric providers together with subspecialists to get smarter about all things pediatric and better acquainted as a community of caregivers. The Virtual Curbside is brought to you in part by a generous grant from Primary Children's Hospital. Primary Children's Hospital, the child first and always. Welcome back to the Virtual Curbside. This is your host, Paul Wirkus. We're talking about foster care this month, a topic that I think is so tremendously important. You know, the things that we do in pediatrics, I think that when we search our hearts, the main thing we're aiming to do is to make a difference in the lives of kids and families. And this is a particular population that I think deserves very special care and very informed care. So we're very fortunate to have an expert with us this month, Dr. Kristine Fortin from Children's Hospital Philadelphia, and also from, I can't remember what Coffee Cake stands for. So will you remind us what Coffee Cake stands for?
Sure, it's the Council on Foster Care, Adoption, and Kinship Care.
See, it's so logical now that you say it that way, but I still won't be able to repeat it.
It was designed so that the acronym could be Coffee Cake.
Perfect. And so we talked about some of the problems last week, and so we want to talk a little bit more about optimizing care. Have you developed any disclosures that you'd like to share with us since last week?
No, I have not.
At the end of our episode last week, you were talking a little bit about the notion of people with lived experience who have been very instrumental in making sure that this is the best possible book that we have. And you were mentioning that there's a fund that people can contribute to. Would you like to tell us a little bit about that?
Yes, it's the Mary Crane Fund for Lived Experience, and I can share the link with you. And Dr. Mary Crane was a longtime employee at the American Academy of Pediatrics, who was really instrumental in starting the Council on Foster Care, Adoption, and Kinship Care, and really a leader in making sure that lived experience voices were included in all the work. And in her honor, a fund was created, and the funds help support lived experience participation in activities of the Council.
No, that's great. The occasion for us talking this month, the fall of 2025, is also the publication of a new edition of Fostering Health, Standards of Care for Children in Foster Care, the latest and greatest edition of this book. And we mentioned last week that they can be ordered from the AAP website and that an ebook will be available at some point. And we'll put the links to get the book in our show notes as well. Does that sound okay?
That sounds great.
Terrific. Okay, so some of this is going to feel like we're talking about some of the same things that we talked about last week, but I wanted to just drill down on some of these things. If you had to choose just a couple of qualities for what you would hope a pediatric provider would do, how would you hope that pediatric providers are focusing in order to optimize care for kids who are in foster care?
I think just really taking the time to listen to this podcast, already showing that you're really taking the time to be thoughtful and interested in the special healthcare needs of youth in foster care. And really sometimes just the most basic things make a huge difference for a child in foster care. For example, we see youth who need a vaccine record so that they can enter school, or a child who needs you to sign a form so that they can play basketball, which would make a huge impact. So I think really doing your pediatric care, you really are making a difference. And one thing also is really to be aware of trauma and the impacts that can have on youth in foster care and how you can support the child and family as they navigate that.
You know, it's interesting. You pointed out last week that in some of these instances, these may be kids that we've known for a while, and we may be part of the continuity and stability in their lives.
Absolutely. The medical home can really be such an important piece of a child's journey for all children, and especially for children in foster care.
We talked last week about the recommended AP visits for kids in foster care. The first visit is recommended to be done in the first 24 to 72 hours. Really comprehensive one may come after that. What's the purpose of that first visit again?
So the first visit is when a youth is first placed in care. We really want to make sure they have everything they need to support their health. So if you notice they have a history of asthma, making sure they have those medications. If they have a history of anaphylaxis, making sure the foster parent's aware and that they would have their EpiPen. Also checking for any acute health issues, checking for any acute mental health issues or behavioral health that would need immediate attention that wouldn't make it so the child wouldn't be safe. Sometimes children have, suicidal ideation and need a safety plan, for example, and really making sure that the foster parent has everything they need to help support the child.
So making sure that you've got all the safety things in place, as well as in all the hustle and bustle of what may have gone on in the previous few days, even making sure a child doesn't have strep throat.
Exactly. And making sure that they have those basic healthcare needs and the medication, really, that makes a huge difference.
Tell me then a little bit about how the expectations are different for the comprehensive exam.
So the comprehensive exam is recommended within 30 days, and that is a visit that will be a longer visit. And really, one of the important pieces is to try to gather all the medical information and review that. So that could take a little bit more time than you would have in that initial 24 to 72-hour visit. And the comprehensive visit, you want to think about all the aspects of health. So physical health needs, emotional health, development, and really make a comprehensive care plan for the child.
You mentioned that beyond that point, then, that more assessments are generally recommended than for kids in regular care. How do we facilitate that the best? What's the best way to make sure that we're doing that?
So really thinking about, do you mean just at the time of that visit
Yeah,
or
yeah,
referrals?
yeah.
Yeah, I think thinking through if you're able to schedule a longer amount of time and thinking through who in your office can help. So we're really lucky to have access to an occupational therapist and a nurse care coordinator. Maybe your office has a social worker or a developmental specialist who could help out and provide support for doing the evaluation. And really thinking through all the healthcare needs, the physical health, emotional development, and making sure that you address all of those.
And then we would expect that then seeing a child more times than we would otherwise allows us both to follow up on those things as well as maybe to uncover more information than we had before.
Yes, and also as a child is spending time in foster care, there can be different stressors that arise. That, for example, maybe a child is initiating visits with the family, and that's a stress for the foster parent, or the child's having difficulty transitioning. So, as a pediatric provider, it's good that you can check in and provide supports when needed.
We talked a little bit about trauma-informed care, and I don't think we can ever emphasize that enough, especially in a population who would be much more prone to needing trauma-informed care. Tell us in broad strokes how that might help us not provide the wrong treatment for kids.
I think really we can play a really important role in making sure that a child's when they're having impacts of trauma that they're recognized by the different caregivers involved in their life and that they're also supported. So we do a trauma screening for symptoms. We will screen for sleep issues, hypervigilance, avoidance behaviors, and it's also important to support the relationship between the child and the parent and the caregivers involved. So we have some foster parents who might not have had experience working with children who've experienced trauma, and they might interpret symptoms, take it personally if a child's not paying attention versus recognizing that it's a normal response for the child, considering that they've experienced trauma. So really being able to provide those information and help identify strengths in the relationship and support that relationship between the child and the parent is really important.
When you say you screen every child for trauma, do you use a standardized screen for that, or how do you go about doing that?
We do. We use the standardized screener that was developed in Utah, the care process model, where you're able to identify what are the most prominent trauma symptoms that a child's experiencing, and then provide an in-office intervention and also assess the need for trauma-informed community services like trauma-informed therapy, which is a common need for youth in foster care.
And are there good resources to share with foster parents to help them understand the issue better?
Yes, there's some wonderful resource developed by the AP. There's one called Safe and Sound, and it provides a guide for foster parents that explains how trauma impacts a child and what symptoms they may notice and how they can respond. And then when you go to the website, there's also guides for teachers and coaches and babysitters that a parent could download and offer if the child has a soccer coach that they may think isn't really aware of how to respond to a child with trauma. The parent could offer that to that adult involved in the child's life.
Sure. Maybe not a bad idea for us as we anticipate that taking care of kids in foster care and in general thinking about kids who may have experienced trauma, that we bookmark somehow how to find those things so that we can share them.
So the AAP does have a central website. It's called Relational Health and Trauma Informed Care. And that website links to a ton of resources. It includes resources for families and also resources for pediatricians who want to learn more. There are PediaLink and echoes that you can get on that website.
Oh, wonderful. Maybe we could link to that in the show notes as well.
That would be great.
You alluded to the issue of care coordination, and we really rely on a team to make this happen. You've alluded to the fact that you use occupational therapists and counseling people of various types. So having a specialized clinic, of course, would be the way to do that most easily. And one of the things that I think has come out of the committee is that kids in foster care deserve to be cared for by people who try to do our best to understand the needs of foster care. Is there a way to put together an ad hoc team that would do this the best?
There is a chapter in the book called Preparing Your Office to Take Care of Youth in Foster Care. And there's one for like medical homes, and then there's one for emergency rooms and specialists. And it really is the entire team. It starts with people at the registration. So I mentioned that children in foster care need additional visits. So when we work and link to medical homes, we have specific registrars at the medical homes we use who know that about children in foster care. So when we call for a visit, they know that even if they just were seen for their well visit, they might need a new visit. And thinking through if you have access to care coordinators in your clinic, that can be a source. And children in foster care may have access to care coordination through their insurance or through their child welfare. So it's good to get to know what resources are in your office and in your community to help maximize the supports.
Of course, we want to do everything in our power to make this feel seamless and safe and reassuring for the kids who are in foster care. It seems to me also that one of the thrusts of all this is that we should try to help to make this as seamless and safe and reassuring for the foster families as possible, too.
Yes, and a lot of foster parents, sometimes they'll say, you know, sometimes when I go to a clinic, I feel like I'm treated differently than when I go with my children. And so I think it's important to recognize all the different caregivers and their roles. And a lot of people don't know that the main goal of foster care is a lot of children are reunified with their families. And so their families of origin are still very much involved in their care. Recognizing the role and the importance of each caregiver is important.
And there may be education that comes about, even if they've not dealt with asthma before, that we're getting people up to speed with care of asthma to make sure that this child is as safe as possible.
Yeah, absolutely. I've had a foster parent say, I've never had a child with asthma. So that would be a really important thing to provide education on how they can care for this child with asthma.
You mentioned last week some of the issues that may help with some of the patients who are preparing to transition out of foster care. You want to reiterate some of those? I thought you had some great suggestions.
Yes, thinking about youth transitioning out of foster care, starting early and making sure they're aware of all their healthcare needs and asking what is important for them is really important. What are their priorities that they want to address with their health? It might not match what your priorities are. You might think they really need therapy, and that could be true, but the youth might not be ready for that at the time. So really making sure that they know how to access care in the future and really know what's important for their medical care.
It's interesting because we define adulthood legally, but it's also an emotional construct and it's a developmental construct. And as you mentioned, there very well may be some instances where patients who we're taking care of, it's important for them to understand that we still have an interest in them, even potentially beyond the time that they've aged out of care.
And it's really important for youth to have a trusted adult. And maybe that's the pediatrician or like helping you think through, like if you had a healthcare need, who is someone you could call to help you with that? That can be an important step in knowing community resources. We have a nonprofit in our community who can link youth in foster care with mentors. So that's something where we think about for our patients who maybe can't identify a mentor in their life, like is there a program that we could help link them to?
And as you mentioned last week, there may be some patients who we may, on some basis, continue to care for. And at the very least, helping them find, for instance, a child who has a chronic healthcare need, helping them transition to subspecialists who take care of adults. It's difficult enough if you have your family supporting you, but if that's not going to be possible, that we can be available.
And getting to know your resources in your community, even with medical homes and primary care, to identify a medical home who has providers for young adults who you think would be really a good match for taking care of youth in foster care. That's what we've done in our area, is found some family medicine and adult medicine doctors who are really open to working with our patients as they transition.
We've talked a fair amount about advocating for patients, advocating for foster families, and advocating for birth families. If you had a wish list of other places where we could advocate, where are some places where a pediatrician's voice might be helpful in helping other people to understand the particular needs of this population?
That's such a great question. There's so many things I would wish for. There is a chapter in the book on policy and advocacy, and that goes through some resources on how pediatricians can advocate, thinking about the different aspects of health, really making sure that youth would have access to quality trauma-informed supports in the community, trauma-informed therapy, making sure there's enough resources is an area I think is really important. And education, I think, as well, and being able to communicate closely with the schools and make sure that they can get supports to be successful in school, I think is a really important aspect.
And it sounds also so vital, as you've talked about, that we're hearing from people who've experienced the system. And as you pointed out, each of the chapters of this book has been vetted by someone who knows what they're talking about from the other perspective of having lived this experience. And the ability to listen and then to amplify those voices is something that the AP is often so good at.
Yes, and I think learning from your patients as well. Like every day when I'm taking care of youth, I really learn when they are sharing their experiences, and it makes me each time better and more, understanding of learning from the youth and the parents that I see in the clinic.
So from everything we've talked about, for one thing, it sounds like I need to read the book, which is great, right? Because we have an actual resource, and we'll link to how to get to the book in the show notes. Because I think that allows me, as with so many other things in medicine, if I can have a proactive approach rather than a reactive approach, then I can provide the sort of safety and stability that these patients and these families need.
Yes, and I think no matter what you specialize in pediatrics, you will encounter youth in foster care. Obviously, primary care and medical homes are so vital, but a lot of our youth do get referrals to subspecialists. And so anyone working in the field of pediatrics will encounter youth in foster care. So I really appreciate people taking the time to learn about this topic.
I'm going to give another shout out to the notion of making sure that we always consider trauma-informed care too. I think that as we think about mental health issues, there are so many things that trauma can look like, but if we're not addressing the trauma, then we're underserving and misserving patients.
It's really vital to understand the symptoms of trauma and, like you said, making sure those are being addressed. And supporting the families and the relationship between the youth and the families is also really vital.
Kristine, anything else that you think would be important for us to understand besides we ought to read the darn book?
I think really understanding all the resources that the American Academy of Pediatrics has about learning more about relational health and trauma-informed care. We can link them in the resources so people can take a look if they want to learn more about that aspect as well.
Terrific. Well, thank you so much for sharing your expertise with us over the last couple of weeks. As you said, almost everyone will have some association with patients who are in foster care. And as I look back on the care that I provided, some of it's probably been good, some of it probably could be better, and I could learn to do a better job.
I find people maybe underestimate what they do to help youth in foster care, and even doing a vision screen and making sure they're connected to glasses, or making sure they have their vaccine record so they can go to summer camp, or making sure that they can enroll in activities and sports and filling out their health physical. All those things make such a vital difference in the lives of youth. So maybe we don't recognize them as something that's important, but it really is.
Yeah.
So the care that we provide really is important.
Terrific. Well, Dr. Kristine Fortin, thank you so much for sharing your time and expertise with us over the last couple of weeks. Thanks to our listeners. Make sure that you are mentioning us to your friends and family because they want to listen to this too, of course. Thanks to Elisa Stoddard for making this sound like a podcast, and thanks, Janice, for listening. We'll talk to you all next week. Thanks for joining us. We look forward to getting together again next time. The virtual curbside is available on iTunes or wherever you find your other favorite podcasts. Be sure to like us and subscribe. We want you to like us both because we're needy that way and because that will help other listeners like you find us. Check out our website, vcurb.com, for supporting materials, schedules, and other great stuff. The Virtual Curbside is an educational production of the Utah chapter of the American Academy of Pediatrics. The opinions expressed in this podcast, while carefully considered, are ultimately the opinions of the presenters and not necessarily of the American Academy of Pediatrics or our employers. And remember, the content of this podcast shouldn't be seen as a substitute for seeking actual personal medical care. If this is an emergency, hang up and dial 911. Otherwise, schedule a visit with a caring healthcare provider to try to get to the bottom of your concerns. None of this could happen without Elisa Stoddard, our extraordinary executive director of the Utah AAP. Many thanks to Tim Cosgrove for his help on the website and logo design. Thanks to Phil Wirkus, who also composed the theme music. See you next time.